If you are over 60, some common medications may be more dangerous than they look.
I'm Dr. Eleanor Hart. Today we explore common meds that can worsen memory after 60.
Let me tell you about Evelyn, whose story highlights these subtle, concerning changes. Evelyn was 76, sharp, independent, yet deeply annoyed by feeling less clear than before. Not completely lost, just foggier, more forgetful, and easily distracted by small things. She began missing small things, calls, bills, appointments. Blaming aging first, naturally.
But when we reviewed her routine, I noticed something many seniors overlook: her medications.
Stay with me. Medication number 5 is often a hidden culprit for mental slowness.
Many people take it unknowingly, not realizing its impact on their memory at all.
James. These are 5 common medications that can worsen memory, confusion, or mental sharpness.
This doesn't mean they're all wrong. Don't stop anything alone.
It means older adults need extra care. The brain becomes more sensitive after 60. Let's start with the first: over-the-counter nighttime sleep aids, especially with diphenhydramine.
Many adults take these for poor sleep, seeing them as a simple, harmless solution.
No prescription needed, easy to buy and justify. That's exactly why they are a trap.
These can cause drowsiness, grogginess, slower thinking, and confusion in some seniors.
They may also linger longer in the body as we age, becoming mental fog the next morning.
Evelyn took a sleep aid frequently, thinking it harmless because it was over the counter.
That's weak thinking. Easy to buy doesn't mean easy on the aging brain.
Some have anticholinergic effects, interfering with memory signals. Older adults are vulnerable.
The second group, anti-anxiety or sedative medications like benzodiazepines. Very common.
For some, they're appropriate. But after 60, they can come with a real price. These meds may cause sedation, slower thinking, and memory issues for older adults.
When used regularly, effects are stronger, especially with poor sleep or alcohol.
Evelyn wasn't taking one daily, but often enough that it mattered.
A medicine doesn't need to be abused to affect you. It needs review. The aging brain often handles sedating medications differently. What was manageable may now disrupt. Third, opioid pain medications like hydrocodone or oxycodone. Necessary sometimes, but mind clouding.
These can cause drowsiness, confusion, and slower thinking in some older adults.
They also increase fall risk. A foggy brain and unstable body are dangerous.
Many assume pain meds only affect pain. That's not true. They affect much more.
Evelyn noticed fogginess on certain afternoons. This detail mattered to find the pattern.
Adults find truth not emotionally or vaguely, but by looking for patterns carefully.
Fourth, certain bladder control medicines, especially for urgency, like oxybutynin.
This surprises many, focused on the bladder, not realizing brain impact.
Some have anticholinergic effects, affecting memory, attention, or mental sharpness.
I'm not saying ignore bladder symptoms. Just ensure treatment isn't creating new problems. This is a cruel trap. One symptom treated, Another burden quietly created.
Because the change is gradual, people blame themselves, not the medication.
Evelyn felt embarrassed, but embarrassment isn't a diagnosis. Older adults need review.
Let me pause. Many seniors aren't suddenly getting old.
Their brains are pushed around by medications they stopped questioning long ago.
Weak people guess instead of reviewing. Do not be one of them. Fifth, certain nerve pain medicines like gabapentin or pregabalin. Very common.
These can be helpful, but in older adults, they may cause sleepiness or dizziness.
They also cause slower thinking or a foggy feeling, mimicking memory decline.
This catches people off guard. They expect pain relief, not mental impact.
The aging brain often reacts differently than younger people expect.
These meds are problematic when combined with other sedating medicines or high doses.
That's why medication stacking matters. One pill is fine, 2 or 3, different story.
Many seniors don't have one memory problem. They have a medication burden problem.
The Klotsternesses. When Evelyn and I reviewed everything, the pattern became obvious.
A sleep aid, a sedative, pain medication, bladder medication, and another fog contributor. None of this made her careless. It made her common. Many older adults are overloaded. Memory changes after 60 aren't always just aging. Sometimes they are medication-related, dose-related, interaction-related, or small side effects piling up.
Until the person no longer feels like themselves. That's the hidden lesson.
After 60, the body processes medications differently. The brain is more sensitive.
Kidneys clear drugs slower, liver handles things differently. Many take multiple meds.
The margin for error shrinks. A dose once fine may now be too much. A combination once harmless may feel terrible. Stop treating meds like wallpaper.
Every bottle, every timing issue, every side effect matters. Review them.
I told Evelyn something simple. Don't stop anything suddenly, but don't take them blindly either.
We made a full list. Prescriptions, sleep aids, allergy pills, as-needed pills, everything. Then we asked adult questions. What, why, when, and did fogginess begin before or after? That's how you find truth. Not by panicking, not by guessing, but by reviewing.
Older adults need to stop being passive about medications. Respect them, question them, review them. That is wisdom. If you're over 60, here's what I want you to do. First, write down every medication.
Not just prescriptions, sleep aids, cold medicine, allergy pills, pain relievers, supplements.
Second, note when your memory or brain fog feels worse. Morning, afternoon, bedtime?
That pattern matters. Third, bring the list to your doctor or pharmacist.
Ask one clear question. Could any of these affect my memory or mental sharpness? Fourth, never stop a prescription abruptly unless your clinician tells you to. That's foolish. Finally, stop assuming over-the-counter means harmless for the aging brain.
If memory problems come with sudden confusion, trouble speaking, or one-sided weakness,
severe sleepiness, fainting, chest pain, or signs of medical emergency, seek urgent care.
If medication causes sudden major change in alertness or behavior, contact clinician promptly.
Don't sit hoping it passes. That's not calm. That's recklessness.
Evelyn didn't need shame. She needed clarity. That is the lesson for us all.
Many older adults fear the worst with memory problems. Sometimes it's not the worst.
Sometimes the brain is carrying a burden it shouldn't be carrying. A medication burden.
One container for relaxation, one container for vitality, one container for comfort, one container for tranquility, one more container. Suddenly the mind feels slower, hazier, less dependable. That's why this matters. Protecting memory isn't just crosswords. It starts with opening the medicine cabinet
And telling the truth about what's inside. Take care of yourself. If this video helped, leave Joubert Amory. Leave memory in comments. Tell me which of these 5 meds older adults underestimate the most. Because after 60, wrong medication burden can look like aging, when it really is something that needs review. Stay informed. Stay informed.